According to the Chicago Tribune, in 2006, 1.1 billion people saw a doctor, either at the doctor's office, at the emergency room, or some type of outpatient service at the hospital. Therefore, we have all seen a doctor at one point or another in our lifetime. The reason I have the credentials to speak about this subject today is because I have done the research of this vocation because I too hope to be a doctor one day. Therefore, I have been informed with all that there is to know about this subject for my future goals. So being a physician in today's world, it may be very challenging but rewarding when blessing others. We will explore today the vocational field of a doctor and how it can be used as a platform for what God values. Being a doctor is a great responsibility, and with the great responsibility comes great duties. In addition, what does it take to become a doctor? First, you have to graduate from high school and get a bachelor's degree in a science field associated preferably. After you get done with your bachelor's degree, you would attend medical school. After medical school, there are two phases to training. The first one is residency, depending on your special focus and your specialty in the field of medicine. It will be 3 to 7 years. In addition to residency program, there is also fellowship training, which is another additional 3 to 7 years, depending on what field you want to focus on. Therefore, a doctor is a very educated individual. They will have 8 years of college under their belt, in addition to 6 to 14 years of training in their specific field. So after one becomes educated in their field, then they have 3 responsibilities. The first responsibility is to diagnose the patient. Second, to do treatment. And the third is to do the follow-up care and the follow-up treatment. So therefore, now that we have looked at what it takes to be a doctor, let's take a closer look on how they could use this to value it as a platform with what God values. First, God values most human life. That's why He created us. In Genesis 1:21, it says that God created us in His image. Therefore, a doctor has to see us as God's image. When one becomes a doctor, they take an oath to do the best of their abilities to diagnose and treat their patients and do no harm. Therefore, whether a doctor is a believer or a non-believer, their oath and the scriptures become parallel with each other. Therefore, they are, in a way, without them knowing it, they are valuing life like God values it, either preborn, elderly, or impaired adults. In addition to valuing human life, doctors should also value the love for others, like God does. In Romans, it states that we should be devoted to one another in love and to honor each other more than oneself, above oneself, as a matter of fact. Therefore, a doctor can do this by simply just doing charitable work, either free clinics or just being in the medical missionary field around the world, or just in their area or in their rural area, wherever they want to be. Therefore, we have explored what it takes to be a doctor and how they can use that as a platform to use it as what God values. It can be challenging at times, but it will be rewarding if it's used to bless others. Such as the value of life and the love of others we have explored today. In conclusions, physicians are trained specialists that can use their gifts and talents for the will of the Lord. But one thing that always one has to remember is that Jesus is the greatest physician of them all.